Travis Danraj with Global News. Please go ahead.
Hi there, Minister. Thank you for taking my question. This report details that Dr. Williams did not lead the government's response to the pandemic. In fact, it says that, politicians in some cases were leading as opposed to medical experts, and that Dr. Williams didn't even chair the health command table meetings. Is Dr. Williams going to stay on? I know that the Premier has asked him to extend, or to delay rather, his retirement. Do you still have confidence in the Chief Medical Officer after this report, and will he be staying on in his role?
I have complete confidence in Dr. Williams. He has over 30 years' experience in public health, both as our Chief Medical Officer of Health, but also as a local medical officer of health in Thunder Bay for a number of years. He has the knowledge and experience to continue to lead us through this pandemic. And I know that he has been a leader throughout. I know what is contained in the report. However, Dr. Williams has provided recommendations from day one of this pandemic to us. And he has been present at all of the health command table meetings. He speaks regularly with the health measures table. He has been the one that has provided us with recommendations that we rely upon. They have served us well, as you can see by where we stand in terms of the numbers and our case numbers, which we, of course, wish that they were lower. But when you compare Ontario to the rest of Canada and to across North America, across the United States, we have the lowest rate of cases. So Dr. Williams has done extremely well and has led us through this.
So then, Minister, how do you explain, these quotes from the report then? Despite COVID-19 being a public health pandemic, we noted that those with public health expertise did not play a leading role in the ministry's response. Medical officers of health informed us that they were confused by provincial politicians delivering public health advice in place of the Chief Medical Officer of Health.
I know that there are some items contained in the report, as I've indicated, that we had an agreement to disagree about certain aspects of the report. I did have a discussion with the Auditor General. I advised her that there were some factual issues in her report with which we did not agree. I believe you've already obtained a fact sheet from us containing some of the issues that we disagree about. And so my response is that we were guided by the recommendations from Dr. Williams, the Public Health Measures Table, by Public Health Ontario, and many others who contributed to those tables that ultimately led to the recommendations made by Dr. Williams as our Chief Medical Officer of Health. That is how the system has worked from the beginning, and that is what we as a government have relied upon.
Your next question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Hi, Rob.
Hi, good morning, Minister. Some of the things in the auditor's report included, some of the concerns included recommendations from Dr. Williams should be made public, as was recommended by the SARS Commission. Are you going to start doing that?
Dr. Williams has been making his recommendations public. He has appeared at many of the press conferences at 1 o'clock, but he also has his own briefings with the public that people are welcome to listen to him and understand what he has to say. That's separate and apart from any of us in elected office. It's important, as the Premier has always said, that the people of Ontario know everything that we know in government, and we have been very transparent with that. Dr. Williams, and in some cases, Dr. Yaffe, Dr. Brown have also appeared. It's important for the people of Ontario to know the information that we have so that they can understand why we need to make the decisions that we need to make. So Dr. Williams has been present throughout and has indicated his views on a whole variety of issues.
I think I'm going to have to take issue with that, because having him appear at a news conference and talk about things is not the same as actually finding out what his recommendations are. So because of this, we don't know if you are making any decisions where you don't follow his advice. So can you address that? And are there any instances where you have not followed his advice, or have you always done exactly what he said?
We have always followed Dr. Williams' advice. There might be a couple of small issues where we've discussed some potential small changes with him, but Dr. Williams did appear at the Select Committee last week with me, and he answered the question himself. The question was put to him whether we listened to him and relied on his advice, or did we not? He had the opportunity to state that. He's a very honest and man and a man of integrity. And Dr. Williams himself indicated that we did follow his recommendations.